Stage what?
She was in stage, was it 3, I believe?
I think it was stage 3, yeah.
She's very lucky to be alive.
She's lucky to be alive.
Large.
They took out, the doctor had mentioned it was something akin to, it was really in her fallopian tubes. And
how many years ago was it?
And she was 30, it was about 10 years ago.
She's lucky
She'll
to
be
be alive.
41. Mm-hmm.
So maybe she had stage 2 ovarian cancer.
Well,
2 is
maybe it
both
was
ovaries.
stage
2 is both ovaries,
okay.
but not spread beyond the ovaries.
Okay, right, because
Okay, then that's...
she had had a regular pap smear everything test in June, and in January didn't feel well, and in February that's where they found it. In March they
It's unbelievable.
took it out. So yeah. Mm-hmm. So anyway.
So, and what was your question, Regina?
You know, my question was on what about vitamin B12 shots? Are they any good?
You don't need to take shots. You can take sublingual or buccal.
Oh.
So
Okay.
you don't need to take a shot. They only evaluate if your B12 level is low. They will suppress homocysteine levels a little bit, so usually most manufacturers, when you take the B6 and B9, they throw in 1,000 of B12. The absorption by mouth is very low. The best B12 is by shot, but the second best is oral or buccal mucosa. And I can measure your B12 level and
well,
find out what's
that's
going on.
that's what I wanted to know. It was when you take the medicine, from Costco that we take. I think it's mature.
Yeah, it's mature, or what? It's like Centrum Silver.
It's like Centrum Silver, and that it seems to have a lot of vitamin B. And one would wonder, well, does one need vitamin B? How does one tell when one is it through the blood test that you need vitamin B?
The B complex vitamins are the vitamins that are responsible for transferring methyl groups onto other proteins, so it's critically important for longevity. The easiest thing is just to measure your levels when we do the SpectraCell on you. Because you have that nail issue, you need the SpectraCell test.
Oh, that's right.
So you don't have that semi-lunar thing.
Yeah, and you know, when you first, thank you for mentioning that. And yeah.
So most of my patients are on a combination of B6, B9, and B12. B6 is called pyridoxine, B9 is folic acid, and B12 is cyanocobalamin or B12. And I recommend the combination of B6, B9, and B12. It'll help you. It'll be a little bit for heart health. It'll have a tiny effect on the breast also. It's not going to make a major life and death difference, but it's part of general overall health. I do recommend it. I take it myself.
Now, is that in combination with the one?
The Centrum or anything like that from Costco is garbage.
Okay, so you're just, okay, so you feel that maybe you can get the rest of the vitamins from food?
No, no, no. You need to take supplements.
You need to take the supplements.
Yeah.
So you have the
Bring
three
the ones.
down.
Bring the ones that you're taking,
Yes.
and I'll recommend after I see everything in your old records, I'll recommend the best ones in the world for you. But Centrum is worthless, and the inexpensive ones that you get for $7 a month and $10 are worthless. So
Okay.
you get what you pay for.